Hello everyone, I am Dr. Chirag Chamria and I am practicing with Royal Dental Clinic since the past 4 years. As a maxillofacial surgeon, we come across a lot of cases of oral ulcerations. Patient gives us a call and says, I have had an ulcer in the mouth since the past 1 month and now that ulcer is paining, I am not able to eat and that ulcer is also growing in the mouth. Or I have a very small ulcer in the mouth, I don't have any habits, it's just been 2 days. Both these are oral ulcers, both of these conditions are very different. History of the patient is the most important factor when we come across oral ulcers. Before I describe this topic in more detail, there is one concept which you need to understand. Any oral ulcer greater than 2 weeks old in the mouth needs to be investigated further. Usually, aphthous ulcers or stress ulcers heal in 10 to 14 days. Aphthous ulcers or oral non-malignant ulcers do not grow so rapidly. They are either reddish or have a white, thin, necrotic skin layer over it. Whereas a sinister ulcer usually presents with a long-standing time greater than 2 weeks. There is difficulty in eating, there is pain. The ulcer keeps on growing and becoming worse day by day. The tissue around it or the area around it also swells and becomes hard, and hence it is very difficult for the patient to manage. At this point of time, for aphthous ulcers or stress ulcers, multivitamin therapy, painkillers, anti-inflammatories, sometimes even betamethasone or steroid mouthwash is useful. But if the same treatment is given for a sinister ulcer, it will have a negative impact on the treatment. Hence, any ulcer greater than 2 weeks should be investigated by a professional. Say now we have an ulcer in the mouth which is just been for 5 days, it doesn't look sinister, then we can give the therapies which we have said before and it should heal itself. But say an ulcer, a 1-month-old ulcer, having the other clinical features, then what should be done? The first step is take a biopsy of that particular area. That biopsy should be deep enough so that some deeper layers also come into the architecture of the tissues. It needs to be investigated for cellular level changes of what kind of malignancy or what kind of atypical features are seen in that particular lesion. Oral cancers in stage 1 and stage 2 are very curable. They have a very high prognostic value. But that prognostic value drops rapidly in stage 3 and stage 4. Hence, if you find that you have an oral ulcer, it may be due to a tobacco habit, it may be due to a sharp tooth, but it is not healing and it has been more than 2 weeks. You should not delay further and immediately go to a professional for the same. Thank you.